Nurse Staffing and Patient Outcomes, a critique of qualitative research studies. Background of study. Fulfilling work in an appealing job environment is a desire of many professional personnel in various sectors, one that does not leave out the nursing care professionals. The majority of healthcare settings experience a poor nurse-to-patient ratio. Caregivers are obligated to an overwhelming number of clients, which results in increased incidence of burnout. Several studies have assumed varied opinions in support or contempt of problems related to shortages of primary care professionals. In the present case study, 2 qualitative studies were compared for validity over challenges related to inadequate nurse staffing and healthcare outcomes. Summary. Despite efforts by the federal and state governments to address professional nurse shortages, the problem remains a concern in the United States healthcare system. To aid in understanding the problem, 2 qualitative studies have been reviewed. In their qualitative study aimed at determining nursing care professionals' opinions on considerations that ought to be made to achieve desirable maximum nurse staffing in critical care areas, nurses reported that they were unimpressed with staff shortages. According to Wolf et al., the nurses' concerns were observed to lean towards the safety of the general health care provision given the adverse patient outcomes, as a result of shortages experienced among professionally trained nurses in most hospitals. This is a particular problem for the nursing care staff working in the shortage areas given the increase of an individual nurse's workload at any given time. Nurses being at the center of primary care remain particularly on the receiving end of inadequate staffing. Some of their challenges are related to increased chances of patient neglect or delay in attending to patients in good time and the inability to rescue patient situations promptly, therefore increasing the number of hospital revisits and hospital readmissions for patients. In another comparative qualitative study determining the importance of nurse staffing, the study reported that proper and technologically assisted nurse staffing corresponds directly with patients' quality care. Following nurse technological use, patient safety has been enhanced besides the increased patient outcomes, healthcare providers' safety, and quality care admission, and the profitable gain accrued to the healthcare organization in terms of profits. Therefore, the objective of this study is to compare the qualitative findings from the 2 previous scientific reviews to establish whether in nursing professionals who are understaffed, make use of alternatives aimed at revitalizing their psychological needs to increase their effective use of time, as compared to utilizing clinical nursing ideologies, affects a positive change among the nurses, Scientific evidence for adequate nurse staffing. These 2 articles are an essential arsenal in favor of appropriate nurse staffing. They can help address the problem of nurse staffing through approaches and alternatives outside nursing, such as through the use of technology. As a matter of fact, Nickitas and Mensik advocate for the utilization of electronic scheduling systems and staffing by the determination of patients' actual time-bound needs. In this regard, the system is set to promptly respond by alerting the individual primary care professional allocated to the patient, thus increasing the care provider's response time to care, hence enhancing quality and better patient outcomes. It promotes patient-centered care in line with evidence from approved scientific practice. As for the interventions and comparison groups, the first study made use of a qualitative exploratory design from primary data obtained by interviewing 26 selected acute care nursing staff. Thus, the first study aimed to determine the nursing staff's areas of concern regarding inadequacies in comparison with actions capable of providing optimal patient and nurse outcomes. The second study, however, made use of technology amidst an understaffed nursing operational area to see the effectiveness of electronic staffing and the electronic scheduling of nurses over specific patients compared with having the understaffed nurse operate without technological aid. From the second study, the level of nurse satisfaction and patient satisfaction improved with the inception of technology. Method of study. In the first study, a qualitative exploratory method over the study theme used a constructivist approach. In the second study, a systematic approach aimed at specific nurses was used to note the outcomes of quality care provision and patient satisfaction. These 2 methods are related to each other in that they both focus on the interests of the nurse in an understaffed area of operation and are aimed at finding solutions to the prevalent nurse staffing problems. The qualitative exploratory approach is beneficial in that similar concerns are raised in varied environments but limited to the fact that it only focuses on emergency care nursing staff. In the second study, the research methodology is beneficial in that it provides room for comparison and involves the use of technology. However, it is still limited to the fact that it did not purely address the nurse staffing problem. The qualitative exploratory approach is desirable but is limited to a specific topic or problem in the care settings. Results of study. In summary, the two studies revealed that nurse staffing problems are prevalent in most care settings, though little is done to address the problems ailing the nurse staffing issue. The two studies also revealed that having an adequate number of nurses holds the potential to change the healthcare's negative outcomes to more profitable, safety-enhanced, and blessed with a morally psyched nursing care team. Technology is vital to addressing the effects of nurse staffing shortages and could help achieve quality care even with a low staff number. These two studies add to the voices of nursing practice that advocate for adequate nurse skillful staffing and the possibilities of engaging technology for better healthcare outcomes. Ethical consideration. Scientific research thrives on critically approved and analyzed information, as the codes of operation determine the best research practices. Informed consent and confidentiality are some of the critical ethical needs for such studies, as individuals' livelihoods and lives are on the line and should not be jeopardized by distrust. As for informed consent, all the studies sought approval from the various study subjects and allowed them the chance to know what they were up to, what the benefits were for the study, and why the study had chosen them and had not chosen other persons in the same cohort. Scientific validity is another key ethical concern that all scientific research studies must use to make the information contained in the write-up authentic. The studies used scientific styles to determine nurse staffing challenges and inform subject selection and validity. The provided information was reliable, credible, and relevant to the topic. The two researchers kept their contacts unknown but made the data from the interviews available to the larger public's consumption, thus observing the two ethical principles above.